The World Health Organization says the number of adults suffering from diabetes has quadrupled since 1980. The first ever WHO report on the disease says 422 million adults had diabetes in 2014. That's compared to 108 million in 1980. The agency blames the rise on the way people eat, move and live, and it describes the report as a call to action. Let's take a closer look at the global impact of the disease. Diabetes is the 8th leading cause of death in the world. More than 5 million people die from the disease each year. Another 2.2 million deaths are linked to high blood sugar levels. The WHO says developing countries are recording the highest number of diabetes cases. Let's get more on this and speak to Cherian Varghese, who is a WHO coordinator specialized in non-communicable diseases. He joins us now from Geneva, Switzerland. Cherian, many thanks for joining us today. We just went through some of the numbers there, this extraordinary increase in diabetes. What is driving this rise in diabetes?
Yes, thank you. And WHO has highlighted diabetes as the theme for the World Health Day, which is the way of raising awareness to the whole world. And as you have mentioned, we estimate that there were 422 million adults with diabetes in 2014 compared to 108 million in 1980. This is a huge increase, and most of it is driven by overweight and obesity. 1 in 3 adults is now overweight, and 1 in 10 is overweight, and 1 in 3 is obese. So this itself has raised the risk of diabetes substantially high. And this has got multiple drivers. It is the way we eat, it is the way we move, and essentially the living pattern has changed drastically. The rise is much higher in low and middle income countries because that is where the urbanization has become very rapid. That is where the food environment has changed. And it is also seen in lower income category populations, and mainly because it is cheaper to live unhealthy. People can get unhealthy food at a lower price. It is less sort of physically active work that people are doing. And as a result of that, the increasing overweight and obesity leads to diabetes. Now, the second major challenge is that even if people have diabetes, it is not detected in most people. Even though the detection is very simple using blood sugar, only about half of the people with diabetes get diagnosed as diabetes. That leads to a serious problem because when people don't have diagnosis of diabetes, that leads to various complications. And diabetes is a disease which can cause heart attack, which can cause stroke, which can lead to blindness, which can lead to kidney failure, and also amputations in the lower limb. These conditions can be a huge catastrophic expenses on the person as well as on the health system. So WHO has highlighted the burden and the complications that arises from diabetes and calls for immediate action. Now, the action should focus around prevention, and in prevention, it should be helping people to live healthy. So it should be a lot of policies which will make food easier and cheaper for people. It should be enabling people to move physical activity, having parks, having public transport systems, having payments, school-based programs where children are made to have physical activity every day. We can have workplaces which are healthy, and the whole food environment has to change. And there are examples of taxation on unhealthy food. There are examples of labeling of food to make it healthy for people. So this is the whole prevention part of it. And in addition, prevention has to start from very early. We know that breastfeeding itself is a protective factor. So babies should be breastfed, infants should have healthier food options, young children should be protected from marketing of unhealthy foods. And once they grow into older ages, the same environment should continue, but also there should be a way of getting them checked if they have a high suspicion of diabetes. And once the diabetes is diagnosed, there should be a very good management system, which is through an integrated primary care approach that they should be managed adequately. And it is simple generic drugs are available. It's not very expensive when diabetes is not complicated. And with good management, people can live longer and live healthy lives. So WHO's main message is
Cherian, sorry to cut you there, but really interesting to hear your thoughts there. Cherian Varghese, WH coordinator for WHO, joining us there from Geneva. Many thanks.